morning, everyone. Thank you all for joining us this morning. We're here today to share the latest updates about our response to the COVID-19 pandemic and to outline several new guidelines. We will also share news about the counties that have qualified to enter phase 1 of our reopening plan to build a safe and strong Oregon. I'm joined by Pat Allen, Director of the Oregon Health Authority, and Dr. Dean Seidlinger, our state epidemiologist. It's been over 7 weeks since I announced Oregon's Stay Home, Save Lives order. We have stayed physically distant from our friends and our families, postponed weddings, missed out on concerts, and canceled graduation parties. My heart goes out to the class of 2020. As businesses close their doors to protect their employees and their customers, so many Oregonians have lost their jobs and have lost income. This has been extraordinarily difficult for all of us, but it is saving lives. Already, these sacrifices have prevented as many as 70,000 COVID-19 infections and 1,500 hospitalizations in Oregon. Our success this far gives me confidence as we take the next steps towards our reopening process. Yesterday, we released new statewide guidance for childcare. Soon, we will provide statewide guidance for public transit operations and youth summer camps and summer school programs, and on the operation of gyms in phase 1 counties. Full details are available on our website at coronavirus.oregon.gov. In addition, I want to remind all Oregonians that last week we issued updated guidance for retail businesses throughout the state. Most retail businesses were never required to close, but many did. Thank you. Many retailers are gradually reopening under safe physical distancing protocols. This includes Main Street shops, furniture stores, and other retailers that can implement physical distancing. One other note about statewide rules. People who usually work in an office and have been working from home during the pandemic must continue to work from home. This is incredibly important to limit the spread of the disease. Thank you to our business owners and our employees for following these very important rules. Now, let's talk about Oregon's regional approach to phase 1 reopening. 3 counties have not yet applied for reopening. They are Multnomah, Washington, and Clackamas. We received applications from 33 counties seeking to enter phase 1 reopening. We reviewed these applications for completeness, posted them online right away, and forwarded them to the Oregon Health Authority for their review. OHA's team of medical and public health experts reviewed each application. In some cases, we asked for clarifying information. After a thorough and detailed review, I have approved 28 of these applications. In each of these counties, we will continue to monitor testing rates, effectiveness at contact tracing and isolation of new cases, hospitalization rates, and other metrics that are required to remain open during phase 1. The counties that have been approved for phase 1 are Baker, Benton, Clatsop, Columbia, Coos, Crook, Curry, Deschutes, Douglas, Gillum, Grant, Harney, Hood River, Jackson, Josephine, Klamath, Lake, Lane, Lincoln, Lynn, Malheur, Sherman, Tillamook, Union, Wallowa, Wasco, Wheeler, and Yamhill. This is good news. I also have to announce that at this time, there are 2 counties that applied for but do not currently meet the criteria for phase 1 reopening. These are Marion and Polk counties. We will revisit the status of these 2 counties on a weekly basis. I will let Dr. Seidlinger and OHA Director Pat Allen address the specific challenges facing Marion and Polk counties. I want Oregonians to know that we will continue to work closely with local public health and elected officials in these communities to address the spread of the virus. I am committed to reevaluating their applications each week in the hopes that each of these counties can meet the criteria for Phase 1 reopening very soon. The applications of 3 counties, Jefferson, Umatilla, and Morrow, are still under review. We have asked them for additional information, and county leaders are working very closely with us and providing that information. We'll make any decisions public as soon as possible. It's really, really important to emphasize that in all of these cases, the county leaders submitted very detailed applications. The county commissioners pressed and advocated for their counties to be reopened. But my job is to make hard decisions, even when they are unpopular. And when it comes to the health and safety of Oregonians, the buck stops right here. Overall, I was incredibly impressed by the work that counties put into their applications. The prerequisites that we laid out were excellent. They were an excellent roadmap for counties to be prepared for future challenges. We are all much better prepared now than we were before going through this exercise. Reviewing these applications reinforced the fact that these were the right requirements and that we must remain vigilant in the coming weeks. Starting tomorrow, counties that are approved to enter Phase 1 can begin the limited reopening of the following sectors under specific safety guidelines. So, restaurants and bars in these counties will be allowed to open for sit-down service as long as they maintain 6 feet distance between parties, limit parties to a maximum of 10 people, require all employees to wear face coverings, and end on-site consumption by 10 p.m. Personal care businesses, including barbers and salons, may open in these counties as long as they screen clients prior to service, limit visits to scheduled appointments, record their client list, maintain physical distance between clients, and require providers to wear face coverings. Gyms in these counties may open in a limited capacity, so long as they can maintain a physical distance of 6 feet between gym users, close all showers and pools, and have very strong cleaning protocols in place. Finally, in these counties, we'll also be allowing in-person gatherings of up to 25 people for any purpose, so long as physical distancing is maintained. Now, let me be clear. Some people will hear these rules and see the list of counties entering Phase 1 and say we are still being too restrictive. Others will hear the exact same information and say we are moving too quickly to reopening the economy. I've been in this job long enough to know that I am not here to make everyone happy. And if I tried to please everyone, well, then nothing would get done. I'm focused on protecting the health and safety of Oregonians while understanding that job losses have a negative impact on public health, both physical and emotional health. The shared goals of good public health and a strong economy are intimately connected, and it's not an either-or scenario. As I said last week, as we reopen parts of our economy, we know and expect that there may be an uptick in new coronavirus cases. Reopening any part of our state comes with risk. The virus is still very dangerous, and until there is a reliable treatment or a vaccine, unfortunately, we will not be able to go back to life as we knew it, not here in Oregon or frankly anywhere. All counties entering Phase 1 will need to stay in that phase for at least 3 weeks before any furthering of restrictions. And frankly, people need to know that if there is a significant spike in cases in a community, a spike that cannot be addressed and contained via contact tracing and quarantine, that we may need to put the stay-at-home rules back in place in order to contain the virus. I know this is a tough reality to face. We are venturing out onto thin ice, and we need to step carefully and cautiously. This is another reason why everyone across the state should continue to practice physical distancing and wear face coverings like these. Each day, more and more Oregonians are making face coverings or getting one from a neighbor, whether it's a bandana, a repurposed quilter's fabric, or a dust mask found in the garage. We wear these face coverings because we are on the lookout for ourselves, our family, and our neighbors. Thank you all very much. I'm now going to turn it over to the Oregon Health Authority Director, Pat Allen. Pat, take it away.
Thank you, Governor. This morning I want to tell you how we reached the decisions about county reopening that Governor Brown just announced, the factors we weighed, the data we reviewed, and the information we relied on. For many Oregonians who live in counties that we've approved to move into Phase 1, I know today's announcement will come as welcome relief. For Oregonians who live in counties that didn't get a green light, I know this may be hard news. And for Oregonians who live in counties that were not yet ready to submit applications, you may wonder how long it will take before your county can even reach a decision point. Regardless of where you live, my message to all Oregonians remains the same. More than ever, we are all in this pandemic together. Getting to open, staying open, and moving on to Phase 2 depend on all of us protecting each other, our families, and ourselves. We've flattened the curve in Oregon. We continue to see hospitalizations drop over time. More Oregonians are being tested. Yesterday, labs reported more than 14,000 COVID-19 test results to the Health Authority. The percentage of positive tests continues to decline. Last week, it was approximately 3%, which means our testing capacity is sufficient to quickly identify people who are sick. But COVID-19 is still present in Oregon. Every community remains vulnerable to the virus. That means our personal actions each day will either slow the virus or spread it. Practice physical distancing. Stay 6 feet apart. Don't gather in large groups. Remember some of the advice from the very beginning of the pandemic. Cover your cough or sneeze into your arm. Stay home from work or stay home generally if you're sick. As the governor just said, wear cloth face coverings when you're out in public and can't physically distance to protect others in case you have COVID-19 but haven't yet shown symptoms. Face coverings reduce the risk that healthcare workers, grocery store employees, and others who work in essential businesses face. As we move into reopening, your face covering also protects the waiters, hairstylists, and retail employees that are helping your life return to something closer to normal. Find ways to stay connected to the older adults in your life or friends and family with chronic health conditions without coming near them. If you are an older adult or have an underlying medical problem, you should still consider staying home as much as possible and limiting your interactions with people outside your home. If you're an employer, keep your staff and customers safe by following state guidelines and encouraging physical distancing throughout your business. And if you're a consumer, respect physical distancing requirements in stores, restaurants, parks, and other places, and avoid unnecessary travel. Here are other vital actions every Oregonian must be prepared to take. If you're diagnosed with coronavirus, a state or local public health contact tracer will ask you for information about people you've been near and who may have been exposed to the virus. Tell them. If a state or local public health contact tracer calls to tell you you've been close to someone who's become ill, follow their advice. Be ready to isolate yourself for up to 14 days to protect the people around you. Until we have an effective vaccine or treatment for COVID-19, testing, tracing, and isolating are the only tools we have to continue to suppress the disease in Oregon without returning to business shutdowns and other extreme tools. These tools can work, but only if more than 9 out of 10 Oregonians who are identified by contact tracers cooperate with their guidance to keep others safe. Now let me go into some more detail about how we made our decisions about county reopening. As you know, we had 7 criteria that we used to evaluate whether it's safe to reopen. Is there a decline in COVID-19-like emergency room visits statewide? There is. Has there been a 14-day decline in hospital admissions by county? Can we test enough people in each region? Does each county have enough contact tracers to notify 95% of people who may have been exposed to COVID-19 within 24 hours, as well as places to isolate people if necessary? Does each region have sufficient healthcare capacity to handle a potential resurgence of the virus and a surge in hospitalizations? Do local hospitals have enough personal protective equipment to protect healthcare workers? Is statewide guidance in place so workplaces and retail, restaurants, personal services, daycare, and other sectors can open safely? It is. In addition to these key reopening criteria, we've defined other criteria that serve as red flags to warn us a county or the state may be at risk of a resurgence and need additional interventions. These factors include a county lacks the capacity to identify, investigate, or monitor new cases or evidence of significant community spread. For example, are more than 30% of new cases not able to be traced to an existing case? Evidence of more people getting sick with COVID-19 as shown by a 7-day increase in cases or the percentage of positive test results. Evidence of more severe COVID-19 illnesses as shown by increased hospitalizations. When we reviewed the 33 applications we received, we found every county but 2 met the criteria. The 2 counties that missed the mark on the 7 reopening criteria were Marion County, where hospitalizations had increased over the most recent period. In addition, there was a significant increase in cases in early May. Nearly 40% of new cases couldn't be tracked to a known source. And Polk County, where hospitalizations also increased. In Polk County, we also found a high percentage of new cases that couldn't be traced to an identified source. We will monitor these counties for the next 7 days. If trends improve, they can be considered to move on to phase 1. Finally, we did see a rise in cases in Clatsop County in early May. However, that county was approved to move forward because they were able to trace their outbreak to a specific facility, which gave us confidence they could contain the spread of COVID-19 there. Let me be clear. We will continue to monitor every county's trends each week. If we see red flags in the percentage of positive cases and contact tracing data, we will evaluate whether additional action is needed. Do we need to intervene in an outbreak at a nursing home or a processing plant? Do we bring in more contact tracers to track down cases of community spread? Or do we need to dial back the parameters of what's open? COVID-19 isn't going away anytime soon. To keep Oregon safe and strong, we need to stay vigilant and continue to work together to suppress the virus in our state. We've done it so far. We can continue to do it as we take the next cautious steps toward a safe, phased-in reopening. Thank you.
Thank you. We're ready for questions.
Great. Thanks, everyone. This is Charles Boyle again at the Governor's Office. Just a quick reminder, please press 0 if you'd like to get into the question queue. Looks like we have quite a few people in there already. Also, if you can today, please repeat your name and your outlet so that the microphones can pick up who's asking the question. So we're going to start first with Sarah Horowitz from KPTV. Go ahead, Sarah.
Hello. This is Sarah Horowitz. I'm a reporter with KPTV Channel 12 in Portland. My question is about counties that are reopening and what that means for, let's say, residents who are living in counties that have not reopened. Is there guidance that the governor's office has in terms of folks who say, well, I can't get to my barber shop or I can't get to a certain service within my county. Can I travel to one that has reopened? And also with tourism as well. I know that there are some of these counties that have now been granted to reopen that are hot tourist spots. What kind of advice do you have for folks who might want to travel and make plans in that regard?
Sarah's question is whether folks that are in counties like Clackamas, Washington, and Multnomah can travel to other counties for either services or for tourism. And I guess I know this is really hard. I know many of us are really wanting to get our hair done, get our hair cut, whatever you need to do. But we are asking folks in the metro area to be thoughtful of their fellow Oregonians and to stay home and limit their travel to essential need. I know this is hard, but we obviously don't want to overwhelm the rest of Oregon by traveling outside the metro area.
If I could just add quickly.
Sure.
Reopening is a team sport. It's not going to work if some people follow the rules and other people don't, and if people decide to travel, to whether it's tourist destinations or other counties that are open to get services. We need to take this slowly. We need to take it one step at a time, and we need everybody on the team to do their part.
Thanks, Sarah. Next up, we have Lisa from K2. Go ahead, Lisa. Lisa Wesley with K2.
Let's say Wesley with K2 here. Hi. So my question was, Marion County has been unable to conduct contact tracing. You said for 40% of its cases. Is OHA going to step in to assist at all in helping them conduct that contact tracing? And then my other question was about the gyms and youth activities and camps. No guidance has been issued for those areas, but they're included and able to start, reopening tomorrow. And why was that made if no guidance has been issued?
Thank you, Lisa. I'm going to turn that over to Director Allen.
Yeah, I'll take at least the first part of that regarding contact tracing in Marion County. Actually, the statistic is they're doing quite a bit higher percentage than just 40 of the contact tracing. What the statistic refers to is about 40% of their cases couldn't be traced to another case. And that's a warning sign for us that there is a broad degree of community spread in the community. Nevertheless, we are helping them. We're providing epidemiological consultation. We've redeployed 20 Oregon Health Authority staff who are trained case investigators or contact tracers to work with the county to increase their capacity. We've also provided them additional test specimen collection supplies. And as we announced, I think the day before yesterday, we've deployed a number of the Abbott rapid test machines to Marion County, focusing on communities that are particularly at risk. Regarding the guidance, I don't know that I can answer that one.
Lisa, your second question was regarding gyms and when will the guidance be available? Is that correct?
Yes, that's correct. And it's Lachey Wesley with K2 News.
Oh, sorry. Okay. It will be available as soon as possible. Dr. Seidliner, do you have more details than that?
I think we are working on getting that guidance up on the sectors, hopefully tomorrow. We hope that the business in those sectors hold off on opening up until they see the full guidance. It is going to focus on some physical distancing and some of the other broad parameters that Governor Brown laid out, and we'll have that guidance up as soon as it's fully developed.
Before you go on to the next question, I misspoke earlier talking about testing numbers. I think I may have said 14,000 tests. Yesterday was 4,000 tests, which is still a record number of tests in a day for us.
Thank you, Director Allen, for correcting that.
Next up, we've got Les Seitz with Mauer Enterprise. Go ahead, Les.
Governor, it goes back to the missing element of schools. At this point, what do you expect about opening schools? We've heard that the state will leave it up to the counties to follow this new guidance, but we've also heard that the state's planning to open all schools at the same time. So what's the status on that?
Thank you for your question, Les. And your question is whether or not there is guidance available in terms of school districts across the state. The answer is not yet. One of the reasons why we're reopening summer programs and summer camps for children gradually over the next several weeks is we want to make sure that our children across the state have these educational opportunities and can participate safely through the summer months. But obviously a focus of my administration is to make sure that we can get our children back into school at the outset of next school year. Obviously, education is the game changer for our families across the state, and we want to make sure that every child in this state has the opportunity to achieve their full potential. And so Colt Gill, the director of the Department of Education, is working with teachers, with superintendents, with educators across the state to develop a plan for safe reopening of our schools in the fall of 2020. I think the challenge is it might look a little different than we're used to in our pre-COVID life, but I think it's so important, and I think as a state we have to make the education of our children a priority, even through this COVID-19 pandemic.
If I may follow up, Governor, is the intention now to issue a statewide decision on schools, or is there consideration, as you've done today, to allow schools by region to open up?
Les, in terms of the plan moving forward, it would obviously be my hope that the entire state would be ready to reopen in the fall. But as Dr. Fauci has said multiple times, the disease controls the timing. We don't control the timing. And so obviously I would hope for the entire state to open as once. But I do think we're going to have to be more nimble and more flexible with regards to our school year moving forward. And we're going to have to come up with plans to adapt to outbreaks of COVID-19 around the state and its impact on education. I do know in other states, for example, when there's been a bad flu bug, certain portion of students are sick or educators are sick. They ended up closing a school or a school district to slow the transmission of the flu virus. I think the data, and I'll let Dr. Seidlinger speak about the data regarding children, is still not clear yet in terms of transmission regarding COVID-19.
Thank you, Governor Brown. Yeah, we are still lucky that children are relatively spared in this outbreak. As we've heard recently and even announced here in Oregon, we do have one child hospitalized with an inflammatory syndrome that is associated with COVID-19, and our thoughts go out to that child's family, to that child, and we hope for a safe recovery. But even with this, these new illnesses being identified, we know that children are relatively spared. Some children with underlying medical conditions may be more at risk for complications, and some of the teachers and staff in those schools may also be at risk for complications due to their age or underlying conditions. So we really want to take a thoughtful approach, working with the Oregon Department of Education, Oregon Health Authority, our school boards, staff and family members in schools to put guidelines in place that can assure the safety of children as they return to school, assure the safety of staff as they return to school. And it's not going to look like it did last fall. It will look different. And how do we do that in a way that allows children to get back to getting an education? There may be some hybrid learning with some distant learning and in-person learning, but we know that the education is incredibly important to children and their families, and we want to get them back into school as safely as we can, and we will continue to look at that and develop guidelines for that.
Thanks, Les. Next up, we've got Emily Puritan from OPB. Go ahead, Emily.
Hi, Emily Puritan, OPB here. I want to ask about contact tracing requirements. In Deschutes County, the number of tracers in the approved plan falls well below the benchmark of 15 per 100,000 population. How did the county meet the requirements for approval, and what does the state plan to do in the event that tracers are needed in counties that don't have the current staffing levels?
Yeah, I'll take that question. What we did in assessing this is we looked at the number of cases there are today in a county and their success over the last 7 days, particularly, but also over a longer period, in meeting the threshold of successfully contacting cases within 24 hours, 95% of the time. And if they were doing that, rather than require them to basically hire people who wouldn't have a lot to do right now, we wanted to know that they had a solid plan for how to be able to ramp up that capacity quickly. And so it was a combination of what's their success today, what's their load of cases, and what's their ability to add to those tracers.
And does the state have a plan to help counties, especially counties on the east side of the Cascades, in the event that they see a spike in cases that surpasses their plans to ramp up contacts?
Yeah, I mentioned the 20 contact tracers and case investigators that we've deployed to Marion County. That's out of a pool of 100 that we've identified here within the staff of OHA who are available to be able to fill in gaps, work with surges, those kinds of issues as they occur. around the state. We're also then providing direct resources to most counties to be able to add to their own staff, contract with other organizations, work with community health workers, those kinds of things to add to that capacity.
And in a county that's near and dear to my heart, Wallowa County, the Oregon Health Authority is actually the local public health office. So there's a very close partnership there.
Thanks, Emily. Next up, we have Andrew Selsky from the AD. Go ahead, Andrew.
Yes, hello everyone. Hello, Governor. You said that salons can open if they screen clients. Can you give details on that, please? How should they be screened, with what tools, and is there uniformity in a certain baseline, for example, body temperature? Thank you.
Thank you, Andrew, for the question about what are the details for salons, personal services. I'm going to turn that over to Dr. Seidlinger. But again, I want to emphasize we're all in this together, and it's really important that we protect one another. Director Allen mentioned that if you're sick, please stay home. This doesn't matter whether you have COVID-19 or you have a really bad case of the flu or you have a bad cough. We want you to stay home because that's how you prevent transmission, and that's how you protect your neighbors or your hairdresser in this particular case. So, Dr. Seidlinger.
Thank you, Governor Brown. I think building on that, asking people to stay home when they're sick, this is what our screening would entail. So if you're going to one of these salons or one of these other personal services, we ask that the owner or that the person that you're going to see screen you, ask you some questions about how you're feeling, make sure that you're not sick, and if you are showing any symptoms, ask that you not come in for that appointment and reschedule it for a time when you're not sick. Some businesses may choose to take temperatures of folks as they enter in, and that's an augmentation to the screening and the questions they ask, but that's not something we require. We really want to have that dialogue ahead of time so people can be assured that they don't have symptoms and can reschedule that appointment for when they're feeling better if they are showing some symptoms.
Thanks, Andrew. Next up, we have Nick Budnick from the Portland Tribune. Go ahead, Nick.
Hi there. Yeah, Nick Budnick, Portland Tribune. Governor, I wonder if you've seen the May 7th report from the Institute for Disease Modeling, which, if you read the assumptions, it seems to indicate that a general relaxation of social distancing could lead to between 30 and 80 additional deaths over the coming 30 days. I wonder, do you agree with those estimates, and do you think they're relevant to what you are doing today?
Thank you, Nick, for the question. And the question is, have I read that particular study, and am I aware that we're likely to see more cases and more deaths as we begin to reopen? I believe I said in my remarks, and I know this, that as we begin reopening, we're going to see more cases of COVID-19 across the state. As I've said before, this is like walking out onto the ice. We have to make sure that the ice is solid. If it is, we can continue to move forward. But if it's not, you need to move back. And I know that the approach that we have taken in Oregon has saved lives and prevented the transmission of COVID-19. I think we have the opportunity to begin rebuilding a safe and strong Oregon because we're on track to meet the goals that doctors and epidemiologists have laid out for us. We've certainly flattened the curve with physical distancing. We know that reopening will likely increase transmission. In terms of the statistics, I'll turn it over to our state epidemiologist, Dr. Seidlinger.
Thank you, Governor Brown. I think the data and the reports that the Institute for Disease Modeling have been providing to Oregon are very important. In our briefings with the governor and her staff, we include that data because we use it for planning, as well as what we're seeing already being reported from our counties, our local public health partners, our tribal public health partners. And certainly that modeling shows that if we relax the measures we have in place right now, we're going to see increased cases. They also show that if we maintain some physical distancing, use face coverings to protect those around us, and have an aggressive public health surveillance system to test, trace, and isolate individuals who are sick, that can minimize the increase in cases here in Oregon, can minimize the hospitalizations, and also lower the number of deaths we will see from this infection.
Alex Castle, actually here with the East Oregonian. But my question was specifically with Umatilla and Morrow counties and their applications. What information does the state would the state still like to get from them? And is there any particular timeline that the state is looking to for when they'd like to announce the status of those applications?
Thanks, Alex. I'm going to turn that question over to Director Allen, but I want Oregonians to know that county leaders across the state have done an enormous amount of work preparing for Phase 1 reopening. We really appreciate the strong partnership. We laid out extensive prerequisites for the first opening in Phase 1, and we're going to continue to remain vigilant in the coming weeks. We need to make sure that we are continuing to protect the health and safety of Oregonians. Director Allen.
Yeah, thank you. We're looking for working with the county, and we'll be having more conversations with them today, both counties, to gather data about contact tracing. We want to make sure we have the appropriate data to make an informed decision, and we'll make that decision as quickly as we can.
Thanks, Howard. Just a reminder to the folks on the line, please press 0 if you have a question. We have quite a few people lined up already. Next question is from Amy Green, the Oregonian. Go ahead, Amy.
Yes, I have two questions. The stay-at-home order that you issued, Governor, on March 23rd, is that still in effect? The portion that says that we're only to leave our homes for essential tasks? And maybe you could distinguish if it's not in effect everywhere, is it just in effect in those counties that you didn't approve for reopening?
Amy, could you repeat the question, please?
I'm sorry. So I'm wondering if the portion of your stay-at-home order from March 23rd is still in effect, the portion that says that we're only to leave home for essential tasks, or is it in effect in the Portland metro area and counties that haven't been approved for reopening, but it is not in effect? People can leave their home for non-essential tasks in counties that have been approved for reopening.
We are issuing a new executive order very soon, and the requirements in the order will be very, very clear. But as you know, we opened up, for example, some limited recreational opportunities, and in the order it specifies that Oregonians can travel for those specific recreational opportunities. Again, we're asking Oregonians to be considerate and to be thoughtful of their neighbors and to be smart.
Did you have a follow-up, Amy?
So am I? Well, I guess I didn't really answer my first question. Am I, living in Portland, supposed to only leave home for essential tasks?
Yes, we are asking people to stay at home in the metropolitan area for essential tasks. Obviously, we have opened up parts of the state for recreation, for limited experiences, and the new order will ensure that folks can travel safely to those recreational opportunities. Again, we're asking Oregonians in the metropolitan area to be thoughtful and considerate of their neighbors.
Thanks, Amy. Next up,
And then a sec-
sorry, Amy. I'll get back to you in the queue. Next up is Rachel Monahan. We'll have a week. Go ahead, Rachel.
So the CDC guidance on when to begin a phase comeback, as they call it, is a downward trajectory of documented cases within a 14-day period, or a downward trajectory of positive tests as a percent of total tests within a 14-day period. What makes you and other health officials here confident you have a better approach than the CDC on reopening?
Thank you. I'm going to turn it over to Director Allen and Dr. Seidlinger. Director Allen.
Yeah, thanks. Just very briefly, we do have a downward trajectory in the rate of positive tests. We've been increasing the number of tests we've done over the last several weeks, and I think, like we've talked about all along, the more you test, the more cases you'll find, and that's why the number of cases is going up. But that positivity rate has dropped substantially over the last several weeks. It's also why, in addition to those two markers that the CDC refers to, we're looking at hospitalizations, because they kind of exist unrelated to how much testing you're doing or how many cases there are out there. They're really a marker of serious cases, because if they're serious, they will show up in terms of hospitalization, and that number has also dropped significantly over the last several weeks.
Yeah, thank you, Director Allen. I think I'll just build on that. We're looking at multiple markers to see if we're ready to reopen, and we'll continue to monitor those markers. We're looking at decreases in hospitalizations, which we're seeing across the state and seeing across most counties. We're looking at the people who are presenting to the emergency departments with symptoms of COVID, and that has stayed low. We're looking at the number of new cases as well and making sure that our public health system is ready to test, trace, and isolate the individuals that we pick up. So while there is an uptick in cases, some of that is due to changing definitions with a presumptive case definition now that's just come out. And as Director Allen said, testing many more individuals. What we're seeing is that those individuals are having mild symptoms or sometimes no symptoms at all, and they're picked up as part of an outbreak investigation. Our hospitalization numbers continue to decline, and we will continue to monitor that. So looking at all the data together, we feel that with our response that's in place already, the continued building of contact tracers and other resources to meet the needs, that we are in a good place in these counties that are being approved to loosen some of these restrictions and appropriately control the spread of the disease and monitor it continuously going forward so that we can keep Oregonians safe.
Thanks, Rachel. Next up, we have Dick Hughes. Go ahead, Dick.
For this, I have two clarifying questions based on what I've heard from people. The first one is, who is in charge of Oregon's coronavirus response? Some states have had like a czar appointed, and that doesn't appear to be the case in Oregon. So who is in charge of the response in Oregon?
Thank you, Dick. We did not, I did not, as governor, appoint a coronavirus czar. I instead empowered a panel of medical experts to advise me and assist me in decision-making. I think it's fair to say that the medical advisory panel, or the MAP as I fondly call it, has worked in close partnership with the Oregon Health Authority to respond to the coronavirus pandemic in Oregon.
Thanks, Dick. Let's go next to Ted Signature.
Oh, Dick had another question, but Dick had a second question, but.
Go ahead, Dick. Are you still there? I think, Dick, if you're having some phone issues, go ahead and send me an email with your question. Next up is Ted Signature with Oregonian. Go ahead, Ted.
Yeah, can you hear me?
Yes.
Okay. I'm wondering how the state is going to monitor counties for ongoing compliance with the prerequisites. And is it kind of a self-reporting mechanism, or is, it's a trust but verify kind of situation?
Thank you for your question. I'm going to turn that over to Dr. Seidlinger to talk about how the state is going to hold local jurisdictions accountable.
Our public health system in Oregon is just that. It's a system. We have our state public health division here at the Oregon Health Authority, our local public health authorities throughout the state, as well as our tribal public health authorities, and we work together every day before COVID-19 and during COVID-19 to control the spread of disease. Diseases are reported into the state and are monitored through a shared system where our local public health authorities, their contact tracers and investigators enter in information where we can create reports and look at trends through that. We can see if there's a county that may be struggling, there may be several outbreaks, and reach out to see if they need resources for help. And local officials can reach out to the state to say, hey, this is what's going on, can you help us with that? We've been working in that partnership together, and we will continue as we move forward and build a stronger or a larger workforce with providing resources to counties to add contact tracers, with providing collection kits out to counties and ensure that they can get tests to labs so that they can receive those results and do outbreak investigations. So we are working together in the same database all the time. We create reports that we release publicly to you, and that's the same information we use to work with counties. We also ask that businesses, continue to follow the guidelines as they reopen. and we've had a system in place for Oregon OSHA to be able to work with individuals who see a business or may have a complaint about a business not following guidelines, and that will continue to go forward. So we're all in this together. We're working together, not just business owners, not just public health, but all Oregonians to take steps to protect other Oregonians, work together so we can get through this safely.
If I could just build on that a little bit, I think part of the safeguard in the system is the data that we rely on comes from a variety of different sources that are relatively unconnected from each other. Labs across Oregon and other parts of the United States required by law to report positive and negative tests. Healthcare providers who are required to report diseases like COVID-19. Hospitals that are required to provide us data about hospitalizations and personal protective equipment. Local public health entities that are required to provide data about their case investigations and those kinds of things. And that multiplicity of data sources, I think, helps us know that we're getting a variety of data sources. And if something starts going out of whack, one data source looks like it's missing something or not showing a problem, we'll catch that with the other data sources that give us the information we need.
And Ted, on a practical level, I'll continue connecting with legislators and county commissioners on a regular basis. That information has been really helpful to me. I, for example, sometimes receive a text or a phone call, county commissioner notifying me they're setting up a certain program or that they need a particular piece of equipment. I pass that information on to my team, and it gets responded to. So we'll continue to gather information through formal channels, data gathering and other, but also less formal channels.
So is there going to be any kind of dashboard available that the public can look at and how the county's compliance is going and some of this information? Or are you requiring weekly reports just from the counties to monitor them? Is there any of that?
Ted asked if we were going to do some type of dashboard, and I'm going to turn that over to Dr. Seidlinger.
Yeah, thank you for that. I think much of the data that we're going to be monitoring are things that we already report daily. For the things that we're not reporting, we are compiling that information and we'll post it regularly with updates at least weekly so that we can see how are we doing across the state. How is the virus behaving? Where are we seeing new cases and hospitalizations, as well as monitoring hospital capacity, the personal protective equipment, the testing that's going on, and posting that information publicly so that members of the public, our county leaders can see the information about how they're doing and being very transparent with sharing that information on a regular basis so that all Oregonians and those from outside of Oregon can see how we're doing and can see what we're monitoring.
Thanks. We'll go next to Gary Warner. Go ahead, Gary.
Hi, this is Gary Warner with EO Media. This is all based on a very optimistic view of cooperation. You have lots of specifics on what to do and what not to do, where things are opening, where they are not. But there are going to be some people out there who are just going to hear that things are being loosened. If things don't work out as planned, if you start seeing a spike, how do you put the lid back on? What steps are you willing to take to enforce putting the restrictions back on, even if there's opposition? How will you deal with those who basically say, no, we're not going to go back?
So, Gary, that's a really good question. And as Director Allen said so well earlier today, that we are all in this together, and we need to continue to be thoughtful and considerate of our neighbors. This is truly COVID-19, this pandemic is truly a situation where each one of us can make a difference. And that's why I think it's so important for Oregonians to wear face coverings. I think it sends a strong message that you care about other people and that you care about yourself. I think it's really important for Oregonians to comply with the gathering restrictions that we put in place at 25. I know this is hard. I have friends graduating from high school and college this year. This is really, really hard. But we know that if we can't continue to beat back the virus, then we're going to have to implement restriction measures again. And I don't think any Oregonian wants to go backward. I think we all want to go forward, and it's all up to us. We're all in this together.
Thanks, Gary.
I guess I'd like to follow up on that, because there are going to be people who, and I think we've seen them out there already, who don't see this as we're all in this together, who oppose the policies. How far are you willing to go to enforce putting the lid back on if you're seeing a threat to public health?
Look.
What practical steps can you take?
That's a really good question, Gary, in terms of enforcement measures. I've been very, very clear. I know that there are businesses around the state, a few outliers, that are continuing to do business in violation of the executive order. That does not reflect the majority of business owners and businesses across the state. And for those business owners and businesses that are in compliance, I say thank you. Your actions have not only reduced the transmission, it has helped save lives across Oregon. For those outliers, we are taking action. Agencies have the ability to issue fines, and they will move forward. In terms of individuals, this is where it's up to all of us. If you feel uncomfortable that someone is coming too close to you, you need to say something. If you are concerned that someone is not wearing a mask when they should be, ask them, or maybe provide them with an extra mask. Again, this is all up to us. We are not, public law enforcement has really important things to do. I'm not going to be asking them to stop cars that are going to the coast. I'm encouraging Oregonians to be thoughtful and considerate of others. Dr. Seidler, do you want to talk a little bit about sort of if there is an outbreak and what type of outbreak and what, more detail in terms of containment?
Thank you, Governor Brown. I think we can be heartened by the fact that, what's happened in the last couple months hopefully can show us what's going to happen in the future. Oregonians have really come together, by staying apart, essentially. We've listened to the Stay Home, Save Lives order, and most people have stayed home. When we saw traffic patterns, when the information on cell phone travel was put together, people were staying home and really have prevented disease. And I think the vast majority of people will continue to do that in the future. As far as our public health investigations, the Oregonians who've been sick, who've been contacted by our local public health and tribal health partners have been cooperative with investigators, have answered the questions, have stayed home while they're sick until they've recovered. The individuals who are potentially exposed in those household and workplace settings as part of the investigation have also listened and have stayed home. And those things have continued to slow the spread of the disease. We will continue with those outbreak investigations. We will continue to contact more people who are sick, more people who may have been exposed, and we ask that they cooperate with us in public health. If there's someone who is sick and who is having symptoms, who is not listening to public health, and we can't get them to cooperate, we will work with them in every way to get them to cooperate. And we do have additional steps that we can take if they're putting individuals at risk. We haven't had to use those yet because, as I've said, the history can make us feel good that people really are cooperating, and we hope that will continue in the future to keep all Oregonians safe.
Thanks, Gary. We'll try to get through a few more questions here quick. Next up is Carmen Montez with Univision. Go ahead, Carmen.
Thank you. And with reopening of some counties, how is the state addressing specifically cases or the rise in cases within the minority groups, but more specifically with the migrant agricultural workers, where the deadline for the new rules to go into effect has been pushed to June 1st?
Thank you, Carmen, for that question. Specifically, how are we responding to the needs of our farm worker community, and how are we addressing the needs of our communities of color that have been disproportionately impacted by the COVID-19 disease? I'll talk specifically first about the farm worker community. From my perspective, these folks are essential to ensuring that we can get produce off the trees and into the grocery stores. They are key to this sector of our economy, our agricultural sector. And Our agricultural sector is really important to Oregon, both from an economic perspective, but also from a cultural one. This is a key part of who we are as a people. And so it's critically important to me that our frontline workers be safe and have the protections that we need. My team is working on a plan that will invest in both resources for housing to protect and make sure they have safe housing. We're working on a plan to make sure that there's adequate funding and facilities for sanitation, and working to make sure that there are resources for both education and outreach for folks in the farm worker community. I think the other piece that's really important is that we know that a number of these folks depend on the dollars that they make during a very short period of time. And so we're also proposing that essentially there are dollars available to these workers so that they can afford to stay home and not worry about how they're going to make ends meet. In terms of communities of color generally, here's what I would say. We know from what's happening across the country and frankly what's happening in the state of Oregon that communities of color are disproportionately impacted by this global pandemic, and I would argue by any emergency. Therefore, it's imperative that we put the needs of our communities of color first in terms of our response and in terms of our recovery efforts. And from my perspective, as we reviewed each of the county plans, I wanted to make sure that the county contact tracers reflected the needs of the community. And when they did not, we asked them to go back and address those concerns. We laid out the OHSU study. My understanding is that particular study is going to sample from our communities of color as well. In terms of the recovery phase, we know that our rural communities, our low-income communities, our tribal communities, and our communities of color really struggled post the last recession to have the tools and the resources they needed to thrive. As we move into the recovery phase, it's really important to me, as the governor of the state of Oregon, that we put the needs, the resources, the tools, and remove barriers for these communities so that they are at the forefront of our recovery work.
Thank you, Carmen. We have time for just a couple more questions, so we'll go next to Derek Vanderhart with OPB. Go ahead, Derek.
Hey there, yeah, this is Dirk at OPB. I guess my question is possibly for Dr. Seidlinger. You know, I just want some clarity on how we analyze the impacts of this. So in other words, if there is a huge spike in cases Saturday, my sense is that that would not be attributable to the moves we are making on reopening. But as you look at this, at what point do you decide that, yeah, you know, some of the increases that we might or might not see are attributable to this increased activity? I'm just interested in how you analyze that and how we who are looking at the data should be analyzing that and figuring out what might, you know, lead back to reopening.
Yes, thank you for that question. As you stated, you know, what happens on Saturday isn't going to be attributable to what happened on Friday. The mitigation measures we have in place, asking people to stay home and save lives, those measures, what we do today has an impact in the 2 to 3 weeks ahead of time. So we will continue to monitor that. You know, if we see a large spike in cases, whether it's Saturday or another day, we would look at what does that do to? Is that an outbreak in a nursing home where several people tested positive all at once? Is that a workplace setting where people may have been working too close together and not practicing their physical distancing, that we can go in and test and see if they're spread beyond that? Is that multiple cases spread throughout a county or multiple counties that we can't trace back that would indicate that there's spread going on in the community we don't know what it's for? All of those things would take a different response. We would work on those outbreak investigations in a skilled nursing facility or a workplace to bring testing, to get people tested, to trace their contacts and to isolate those who are sick, quarantine those who are not sick. If it is in the community spread, we would work hard to get the message out to people that COVID-19 is in the community, to report symptoms immediately so they can see their provider and get tested. Does local public health need more resources, more contact tracers that OHA can support to do those investigations? So we would respond to each depending on what we're seeing. And if there is truly community spread and our public health investigations can't keep up with that, we would talk about instituting other measures to keep people home more, to limit that spread. And we would have those conversations with our local officials, with Governor Brown and her staff, and with other groups to make sure that we're doing everything we can to keep Oregon safe.
Thanks, Derek.
And I get that. Just really quickly, you know, I guess move on. That's fine. I don't want to belabor this too much.
Thanks, Derek. We'll follow up with you. One last question. We've got Brad Schmidt from the Oregonian. Go ahead, Brad.
Hi, Governor. Thanks for your time. I just wanted to get clarity on the state's testing capacity at this point. According to the most recent report, the state could do 3,150 tests per day, which would be about 22,000 tests a week. As the Dr. Seidlinger has said, if we ease the restrictions, we do expect that we'll see more infections. So do we think that that testing capacity is sufficient statewide, and what are we doing to increase the capacity in light of the fact that we will be expecting to see more infections? Thank you.
Thank you. Dr. Seidel.
Thank you for that question, Brad. I think, you know, testing capacity has continued to increase. It's increased slowly, but we've really seen some opening up of supply chains in the last few weeks. Everything from as simple as a swab, which has been in limited supply in the past, we've seen an increased supply of that. Our federal partners have been providing us here in Oregon with additional swabs, which we've been pushing out to our local public health, our local healthcare partners, so that they have the means to collect the specimens. The reagents, the materials that are needed in the lab to run these tests are becoming in more supply. The federal government has shipped out additional test kits for the Abbott ID Now, the rapid test, and we're pushing those out to communities now so that they can run that test. We have other platforms coming on board to increase capacity in the Oregon State Public Health Lab, as well as our additional hospital labs. And the commercial laboratory capacity at larger corporations that test nationally continues to be there and is an outlet for us if we are doing lots of investigations, have multiple tests that come in at once, that we can use that capacity to test. So you identify that 22,000, and that may be where we are now, but we continue to see that number increase. We have lab capacity to do some of these surveillance studies that our academic partners are doing, and that capacity is available to really help give us some information about how the disease is spread. And if we're seeing large outbreaks or need that capacity, we'll have conversations with those partners about repurposing some of that capacity to help us address outbreaks. So we have multiple avenues to continue to increase our testing. We will continue to increase our testing because it's key to our investigations. We need to test individuals who are sick, trace their contacts, isolate people at home who are sick, and then quarantine people at home who've had contact, and the testing is key, and we continue to have additional testing here in the state.
Great. Thanks, Brad. That's all the time we have for questions, folks. Thanks, everyone, for calling in.
Thank you.